Good afternoon and welcome to the July 26, 2021 school board meeting. A meeting in which we're going to deal with the COVID situation, and to start that off, I'm going to turn it over to Dr. Phipps.
Thank you, Mr. Chairman. We have several pieces of information. I wanted to make sure that Kathy's able to put that up so folks in the audience can see it, as well as folks that may be viewing online as we talk about things. But I had just a brief outline for me to help guide the conversation and then get us to a point where we can have some closure, we hope, and move forward. You know, I would have thought 12 months ago, rewind, that if we got through the school year that we'd be in a situation to be a little bit different than where we are right now. And, you know, we're having to make tough decisions and decisions that aren't easy no matter what the outcome is. There's just a lot of questions and people that have really strong and passionate feelings about the outcomes regardless of which way we decide that we're going to end up. But I wanted to just touch on the update of the North Carolina, with the Strong Schools North Carolina Public Health Toolkit for grades K through 12. You all are probably aware that the governor may have had a press conference last week. The toolkit has been amended. This goes into effect after the expiration of the current executive order from the governor. And the key takeaway for us is that many of the required items that were in the toolkit are now shoulds. And should is encouraged, but certainly not required and not mandated. The mandates are removed and are now really recommended, is what the wording would be. They go into effect upon expiration of the current executive order, and the current executive order from Governor Cooper will expire after 5 p.m. on July the 30th, 2021. So the executive order, other than that, is still in place. The question is, what do we do after July the 30th, 2021? Really, because the word should was put there, the responsibility was laid in the laps of local school boards to make that decision. And that's where we are now to try to determine that. I want to share a little of the Caldwell County COVID-related data so that we would have an accurate briefing of where we are. And I received this information from Page Counts from the county, and Page has been wonderful to work with, as all of our partners are. The first one is a chart. Kathy, I don't know if you have that, is a blue bar chart. And this shows weekly case counts in Caldwell County. And I know that may be hard to see. There it is. And this goes back to, if you'll notice, we just went back to the 30th of May. This will be the very, very end of the month of May into the month of June, and then it carries through the summer up until to the 21st of July, and you can see what the numbers are there. I do think it's important to note on this chart and the chart that you'll see after this, the date 6/13/6/16 is a shorter interval period of time, and that's where the state changed their reporting metrics, and they're reporting over a week-long period of time, so you have a smaller period there. There's no attempt to try to manipulate numbers. I just want you to be aware that the reporting intervals changed during that period of time. So you have that information in front of you. And then I also asked Paige if she could give me information that showed our positive case count and then break that down by age so that you could see what that looks like. And this is really hard to see, to be able to make it out when you're looking at trying to get fine-tuned information, particularly as you move over to the right-hand side of that chart as you get into the month of June and July. This chart, as you see it here, goes back to June of last year. And what I've included in the handout for you is trying to go back to the month of May. And we go May the 2nd to May the 8th, and we continue to go in week intervals as we go through. Now, the case count, and Kathy, I don't know if you have the table information. I know that's going to be really hard to see. If we zero in on March the 2nd, go down a little bit to the end of the document. The number in the left-hand column is the date of the interval period of time where the data is collected. The number beside that is a column that has positive cases in Caldwell County. What you can't see on the headers are the next line would be from birth or from 0 to age 5, and then 6 to age 11, and then 12 to age 18. And what I've done is gone in and added another column to take a look at what the percentages, the total number in the county at any given period of time there, what percentage of that number is made up by students or people that are age 0 to 18. And I can tell you, if we go back to the month of June, and this is not on the chart that's in front of you, the percentage of the county's total in 1 month in June was 8.3, and then it was 6.7 and 10.3 and 7.7, And then there was a bit of an anomaly, it seems, in the first week in July where it went up to 27.3, and then the next week it was down to 0, and for the last reporting period, there were 11.9% of the total cases in the county were made up of students or children that were 0 to 18. Now, an 18-year-old may have graduated, and certainly children prior to age 5 may not be in the school system. So we're talking about people in our county that are in that age range, and we may have homeschool and private school students that are there as well. So the numbers that are reflected in the chart aren't necessarily students in Caldwell County, but they're between the ages of 0 and 18, and I wanted to capture that for you. Some other figures I want to share with you: vaccination rates through the county, with just our county in mind, through Friday, July the 23rd. And my understanding is that this data is reported at noon on these reporting days. So this is through Friday, July the 23rd at noon. 38% of our population have been partially vaccinated. 36% have been fully vaccinated. And one of the questions that we've asked is, what does that look like in terms of school-age children? And you all are aware that you can't get a vaccine right now if you're under the age of 12. So the school-age children number that we're looking at is really age 12 to 17. 8.5% of the students or the children between 12 and 17 have been partially vaccinated, and 7.5 have been fully vaccinated. I cannot tell you of that number, and I've got it, it's 510 children in our county between the ages of 12 and 17 are partially vaccinated. I can't tell you if they're in our school system or which schools they may go to. All I can tell you is that this is what the data is for Caldwell County. So keep that in mind. And there's some lingering questions, and we've had superintendent meetings. I've had an opportunity to meet with our leadership here, and some of these questions won't be resolved today. There'll be questions that we've got to think about and work out as we move forward. And again, I may say some things that you don't like, but I'm just sharing facts with you, and we've got to work through that. One of those is that right now there's some debate as to whether or not face masks are going to be required on school buses. And the legal ruling that I have heard, and we're looking at this before school starts back, is that there is an federal executive order that supersedes anything at the state and local levels that says that students must wear masks while they're on a bus. And we may not have any control over that. That may change. We may get a different ruling between now and when school starts, but that's something that I wanted to put out there to make sure that you're aware of. Again, folks may not like it or they may like it, but if it's an executive order at the federal level that we're not allowed to go against, then we certainly have to adhere to that. More information to come. Another piece that's up in the air, and there's some questions about, is how this would impact pre-K students, particularly if the board were to decide today that masks are mandatory, because you all know that that did not apply for students that were certain ages in the pre-K area. In the new toolkit guidance says that if the child's above the age of 2, then they're encouraged to wear a mask. So if we make that mandatory, how does that play into our pre-K population? And we've got different opinions across the state on that we have to work with. Another potential issue is that if we were to say, for example, that folks who are vaccinated don't have to wear masks or it's optional for them, there's an issue created for school staff to have to determine who the vaccinated are versus the unvaccinated. And I don't know how you do that. That's certainly putting a responsibility and a burden on our staff members that we don't need to have, but that's an issue that has to be worked out. And then finally, details within the school, for example, foot traffic. Is it going to be one-way traffic? Are students going to eat in the cafeteria? What kind of signage are we going to have? Will there be anything different for students in band and chorus where they're involved in activities where they're using vocal and stuff that can happen there? How do we answer those questions? A lot of those things aren't going to be addressed until we know what the board's decision is today. So the way I look at it, I think there are two options that the board needs to consider. And there are many iterations of this, and you can look at it in many different ways. I think number one, the board could decide that face masks are mandatory for all, other than those with existing legal or legal exceptions or exemptions, and we're aware of that. Number two would be that face masks would be optional for all. What I don't feel like we should get into, and if you look at the toolkit, it suggested that face masks should be worn by students in grades K through 8 and could be optional for high school with students who are vaccinated having the option to wear those. I think we need to be all or nothing as we go through K-12, and the same for teachers and adults as we work through that. If we go with the optional face masks for all, there are a couple things that I think we need to keep in mind. And I have been in contact with local officials. We have been routinely as we've gone through this. And I talked with Anna Martin, and I had an opportunity to talk with Laura Easton on Friday, both of them. And what we talked about was more of the different options that are available and how they feel about it. And my question was, if the decision was made that optional was the word that we used for face masks, how would that be handled? How would they support that? And these are the things that they asked to be put in place. Number one, that we have maintained regular communication with health officials, which we have and we will continue to do. Number two, that we daily collect information to monitor status in our schools and our community. Now, I can't tell you today exactly what all of that data would be, but I know we'd be looking at things such as students that present as being symptomatic. But not every student who's symptomatic is COVID positive, and I think it's important to note that. We also would reserve the right to implement restrictions as deemed necessary by school officials and medical officials. This could be at a school level or a local level. And I want to say that we would encourage mask wearing for anyone who chooses to do so. If the board were to go with optional masks, then I would hope individuals who want to wear masks would not feel that they were being targeted in some way for choosing to do that. So we certainly would encourage it. Now, you could go in different options. You could do something different for high school than you do for K-8. You could do something different for your faculty than you do for the staff. But as I look at it, those are the options that I think we need to put in place. We also need to make sure with whatever we do that we implement all possible mitigation issues and factors that we have to work with, strategies other than face coverings to the extent possible if we go with an optional plan. And that could be things like social distancing. If you read the toolkit says wear to the extent possible. We cannot go back to school, face mask or not face mask, and have 6 feet of social distancing, or 3 feet guaranteed everywhere. We would maximize that and do the very best we could. We would encourage outdoor activities. We would encourage eating in spread out spaces as much as possible. I have 2 days of meetings with our leadership team, and principals certainly are included in that, and assistant principals on Wednesday and Thursday of this week, and we'll have these conversations. But I'd like to be able to go back to them and say this is the direction the board has encouraged us to take. The other couple points I want to make, and Anna Martin asked me to share this with our board, and I think this is obvious, but it needs to be stated. At whatever point, whether it happens now or in a month or in a year from now, when our students go back to school and they're not wearing face masks, we're going to have more students that get sick. You all know that. But sick doesn't mean necessarily COVID. We went through a school year this year where we had virtually no flu, very little strep, ear infections, sinus issues, things like that were cut back significantly. We know that there's going to be a rebound with that, and as students have contact with each other, and adults for that matter, we're going to see sickness numbers go up. That's one reason we want to monitor what our symptomatic students look like. If it's a sore throat, if it's a fever, if it's an upset stomach, whatever that is, to try to tease out how many of those are COVID related. But I don't want the public to be shocked by that. We can expect that to happen, and we want to make sure that we manage it. The other thing is that the close contact and quarantine process determination is going to be impacted by the decision that you make. And again, full disclosure, to be honest with you, as much as we can. If we have mandatory face masks, there will be fewer students quarantined. If we have optional face masks, there will be more students quarantined in the event that we have a student who's positive and symptomatic or symptomatic in our schools. And Pam Barber is here, and she and I, Robert, have met. We've poured through the toolkit. We've looked at what our quarantine piece would look like. And it appears that the minimum number of days that a student would be on quarantine if they get into that situation would be 7 days. We have some things available to us right now that we didn't have this time a year ago, and that would be folks in our community that are doing the rapid tests, which is an accurate test when you get that. That was not here when we were doing this and trying to make these decisions last year. So that's trying to put together a great deal of information. And I know you all have monitored the news. You have really strong opinions from individuals that have reached out to you, and I know it's not a difficult decision. Now, I hope that in the lives of children and what we're doing in our schools, we can keep politics out of it and try to be as politically neutral as possible to try to make the right decisions. And I hope this is a decision that's not politically motivated, but is one that we feel like we can rest easy with when that decision is made. What kinds of questions do you have that I can attempt to answer? And Pam is here as well, and representing, she's certainly the head of our school nurses, but with the health department as well. And Pam can vouch that we are in regular contact. And if the board were to elect to go the optional route, I want you to know that we're talking about daily data collecting and that if things seem to be going off course at some point, then we want to make sure that we step in immediately. We're going to do that if they're required as well. We want to make sure that we've got a good census of what's going on in the school system.
Any other comments or questions? Is someone?
Chairman Keel, before you make a motion, I need you to approve the agenda.
Okay.
please.
All those in favor of approving the agenda?
I move
Uh,
to approve the
move.
agenda as presented.
Is there a second?
Second.
All those in favor say aye. Aye. Any opposed? Thank you.
Sorry about that. I guess I was a little eager to get involved.
It's all right. Is anyone on the board prepared to make a motion?
I'll make the motion that we allow face masks to be optional for all students
What about staff?
and staff.
Okay. Is there a second?
Second motion.
Okay, we have motion and a second. Any further discussion?
If I may add,
Yes, go ahead.
I want to make sure that if that's the direction that we go, we know that we're collecting data regularly, and we reserve that ability to come back and say, we need to be more restrictive in a particular area or across the board if that's needed.
Very good, very good.
And may I just, I had spoken to Dr. Phipps about that at one point, that is something the board has already acted on. Is that not correct?
We've not gone back and reversed that, so that's still in place.
Thank you. Okay.
Unless there was an expiration date, and I'll go back and check that.
Thank you very much.
Are you speaking of where we gave you the option, if you needed to take quick action before we could meet, that you would do that?
If we needed to close the school for a particular reason or do something like
Correct.
that, there's not any action like that that I would take without notifying the board.
Well,
We may not be able to convene a meeting quickly enough to do that.
Right. And also, does this include the pre-K? Because I know that was mentioned earlier.
We were trying to work that out, and I'm not sure the details about that. So everything that we say right now would be K-12, and then we'll try to get as
K-12.
quickly as we can to how that is guidance associated with the pre-K. But if you go optional, then it's not required for pre-K.
Right.
Any other comments?
I'd like to make one. Since the governor made this recommendation, I've had many notifications from Caldwell County citizens. I've read them all. I've not responded to any of them. But I found out that 9 out of 10 want the choice. Some of the reasons were anxiety, headaches, carbon monoxide, and even politics. We can't ask the student or the staff if they've been vaccinated, because that's a violation of HIPAA regulations. Our current board is a nonpartisan board, and I'd make no decisions based on politics, because I think politics has no place in public schools. Caldwell County has always been a school of choice, so I think if we make mass voluntary, then that makes us a school of choice.
Okay. I know all of us have gotten numerous emails, and we certainly have read those, and we certainly do appreciate your interest. And as Mr. Knight was indicating, the overwhelming majority of those were to go with the optional approach. So we do appreciate all of the interest that this has brought forth, and we have read intently each one of those, and we are at the point now, unless someone else has a comment or a question, that we are ready to vote. The motion being that we go to an optional situation for K-12, and it has been seconded. Any other questions or comments?
I failed to mention one thing. It's my wish that no child, teacher, or employee will be ridiculed for the choice of wearing a mask or not wearing a mask.
And I would just like to reiterate that those of us who have worked so many years in the public schools realize that there are children who it will be necessary for them to wear masks. And I found as a principal that the schools did a wonderful job in being sure that those children were safe and protected in their environment. And I feel very strongly about that, and I think our educators and our principals do a wonderful job with that because I saw it in my professional life always. And in addition, I'd like to just say that this has been a really, really important time to listen and to hear from our parents and our teachers. And I really feel strongly that parents send us the most important thing that they have every single day. And I value the seriousness with which our teachers strive and our administrators strive to be sure that we're caring for them day in and day out. And last year, as we struggled with these decisions, and they're not easier now, but we're so prayerful and so hopeful that our students will be able to come back to school. And I also want to mention one other thing. In these comments I've read from parents, it is the mental and physical well-being of children that have come to the forefront, the struggles. And so I thank you, parents, for sending me the best that you have and for entrusting that to our educators. And I know that we're going to all work as hard as we can collectively to produce a safe and caring environment conducive to teaching and learning, because that's what we do every day. And I thank you.
And we're pleased that parents will be the one to get to make the decision for their child, for their son or daughter, on what's best for their children, wearing a mask or not wearing a mask.
We made our first decision, I think it was about this time last year with COVID, because prior to that, the decision was made. And there's not been a decision that I'm not going to speak for all the board, but I feel confident that I am speaking for them, that has not been weighed on our minds day and night, weekends, trying to make the right decision for everyone. And we will continue to do that. And we always finish it up with saying that if we have to make a change, please understand it's not just on the whim that we said we're going to do this change. My hope is we don't have to make the change unless things, hoping that things will get better and better as time goes on. But I appreciate all the emails and the input. It's not taken lightly, so thank you very much to the parents, the student, the public, grandparents. We had a grandparent that sent an email that doesn't live around here, but she could see how it affected her children. So thank you very much.
Anything else? Everyone knows the motion on the table. All those in favor say aye. Aye. Any opposed? And it is unanimous. And we are confident that things are going to go well, that teachers and students have the option to wear a mask or not. And certainly we have tremendous confidence in Dr. Phipps and his staff here, and Pam Barber and all the nurses, and Robert Semple and all the work that he's done in the health department. We feel like this is best for Caldwell County at this point, and we will move forward and hope that things just continue to get better as we go along. But keeping in mind, as Dr. Phipps has already said, this is to be monitored daily. So we are going to stay on top of it. They're going to stay on top of it. He's going to let us know. But that is the decision of the board. And If there's nothing else, I need a motion for the board to go into closed session.
Chairman Pennell, I move that we go into closed session to discuss confidential personnel matters and to consult with their board attorney as for reasons listed on our current agenda.
Is there a second?
Second.
All those in favor say aye. Aye. Any opposed? Motion passes. We will be going into closed session. There will not be a decision other than what's already been made. And we are so happy that you were here with us today, and have a good rest of the day.